Now let me tell you a story all about how Biochem flipped my life upside down. Let's start with the urea cycle with amino acids. There are many mistakes that can happen when enzymes are lacking. Carbamoyl phosphate synthetase combines CO2 and NH3 to create carbamoyl phosphate that combines with ornithine via ornithine transcarbamylase to create citrulline. Pathologies are possible due to enzyme deficiencies. N-acetylglutamate is a required cofactor for the enzyme CPS. Without it, NH3 backs up and your liver is a mess. Ornithine transcarbamylase deficiency is X-linked, leading to excess carbamoyl phosphate, which then links to the pyrimidine pathway converted to orotic acid. You can't eliminate ammonia, so your liver has to grasp it. Hyperammonemia results in extra NH3, which adds to alpha-ketoglutarate to make glutamine, so you end up with depleted alpha-ketoglutarate and not enough of it as a TCA substrate. So you have CNS symptoms due to less ATP, and extra ammonia processing leads to hepatic encephalopathy. Now let's take a moment to talk about phenylalanine. With cofactor BH4 and hydrolase, it becomes tyrosine. Blocking this aromatic amino acid step results in PKU, intellectual and growth disability, seizures, and a musty body odor. Phew! But then tyrosine becomes homogenistic acid, which degrades the fumarate through an oxidase. If it's deficient, you get alkaptonuria, with ochronosis, brown sclera, and black urine. And finally, homocysteine metabolism to methionine or cysteine. Homocystinuria results in Marfan-like features plus intellectual disability. Cystathione synthase requires serine and B6 to make cysteine. Homocysteine methyltransferase needs B12 to make methionine. You ever feel like you got too much baggage and it holds you down? Let me tell you about storage diseases that'll surely make you frown. Glycogen storage diseases result in very poor carbohydrate metabolism. We'll start with type 1 von Gurk with severe hypoglycemia-ism. Gluconeogenesis can't make glucose because of deficient G6 phosphatase, so you get extra glycogen in the liver and increased blood lactate. Next to type 2, Pompe disease trashes the pump. Glycogen adds up in the heart, liver, and muscle like gunk. Lysosomal alpha-1,4 glucosidase, aka acid maltase, are lacking. Early cardiorespiratory failure, weakness, and hypotonia send you packing. On to type 3 Cori disease, a milder form of von Gurk. Alpha-1,6 glucosidase cannot debranch glycogen, but gluconeogenesis still works. So there's no severe hypoglycemia and blood lactate is fine. Unlike von Gurk, where you get hepatomegaly and seizures all the time. Finally, on to type 4 McArdle disease and muscle. Rapid fatigue and poor endurance when you're trying to hustle. Glycogen myophosphorylase can't liberate G1P from glycogen branches, so it builds up in muscle, leading to some painful cramping. Myoglobinuria may lead to red P and arrhythmia from electrolyte abnormalities. Now let's flip the script and talk about lysosomal storages, okay? All result in neurologic deterioration, except the liver and Gaucher. Deficient beta-glucosidase in Gaucher shows a necrotic femur like Erlenmeyer flasks. Glucocerebroside accumulates in crumpled tissue paper looking max. Liver and bone symptoms with hepatosplenomegaly and bone pain. Now this is different than Tay-Sachs disease, which presents with cherry red maculae. Lysosomes with onion skin due to broken hexosaminidase A. GM2 accumulates with the loss of milestones, decreased eye contact, startle seizures, and developmental delay. Whereas in Gaucher you have macrophage problems in the liver and bone, Tay-Sachs attacks neurons, and central nervous system is prone. Now think of Niemann-Pick disease as a combination of Tay-Sachs and Gaucher, so you get both liver and CNS symptoms due to defective sphingomyelinase. Now let's move on to Fabry disease due to deficient alpha-galactosidase A. Ceramide trihexoside accumulates and your hands and feet burn when you play. Angiokeratomas present and it's X-linked. Just think, boys' hands burn because they never wash them in the sink. Now this peripheral neuropathy also shows up in Crab A, which is deficient galactocerebrosidase, leading to developmental delay, but it's not X-linked and also presents with optic atrophy and globoid cells. Just think that a crab looks like a globe crawling amongst the seashells. Metachromatic leukodystrophy has both central and peripheral demyelination due to deficient aerosulfatase A, so cerebroside sulfate accumulates in this situation. It stains brown with toluidine blue and presents with dementia and ataxia, with flaccid paralysis and hyporeflexia like you just got hit by Manny Pacquiao. The mucopolysaccharidoses both accumulate heparin and dermatan sulfate. Hurler syndrome is deficient in alpha-L-iduronidase, with hepatosplenomegaly, retardation, and corneal clouding, airway obstruction, gargoyle musculoskeletal abnormalities. Hunter's is a more mild form but can aim for the X and be rowdy. You need clear eyes to see, but can shoot a gun loudly, leading to aggressive behavior and hearing loss. The hunter Igeron ate his sulfatace, and it was gone. If you don't get that analogy, refer to first aid. It's on page 114, spit by the hunger brains.